A very good afternoon to all the parents out here. Thank you for taking your time and joining this session. I promise I would try to make this session really worth a while, and this is in association with BabyChakra. So today's topic is Guide to Complete Oral Health in Kids. So this is going to take care more or less your daycare pattern now, but now why it is more important is because of the corona time. So we're going to cover more about this topic with regards to the coronas. Yeah. So as you all are aware that kids usually have two sets of teeth. One is the milk teeth and the second is the permanent dentition. And more importantly, why are these important is because primary dentition and permanent dentition both should be given equal importance, not just that ki doodh ka daant hai isliye you have to just neglect it. So welcome you all. I, Dr. Vivek Jogani, in association with BabyChakra, I'm going to talk on this topic, importance of teeth and maintaining good oral hygiene for today. Yeah. So the first most primary important question is, whom should I visit for my kids' teeth? Well, you're supposed to visit a pediatric dentist, and a pediatric dentist is just the same as a pediatrician for your child's general health. So a pediatric dentist would take detailed care, and he would record all your child's dentition right from starting, that is at 1 year of age. So the next doubt that usually comes to parents' mind is, when should I visit the pediatric dentist? You should be visiting a pediatric dentist at 6 months of age, or if not, then by the time the first that happened. Very often parents are often confused, when do the teeth start coming, when do they go? So milk teeth usually start coming at 6 months of age, and the entire dentition sets in by 3 years of age. And then the permanent teeth start at 6 years of age. So when the milk teeth start coming, initially it starts with the incisors, that is the front teeth, and then followed by the molars, that is the back teeth. Now what is important over here is all these teeth are going to fall down and being taken care and replaced by the permanent teeth. But when does this happen? This does not happen overnight. This happens over a period of long time. It's a spectrum of 6 to 7 years. So usually the exchange between the milk teeth and the permanent teeth, it usually starts at around 6 years of age and gets completed by 12 to 13 years of age. So usually the front teeth are exchanged initially at 6 to 7 years of age, and then the back molars at 11 to 13. Now, a lot of nowadays, because the kids are more at home, so increase in the snacking in between meals and snacking patterns and things like that, so the chances of decay increases. More importantly, why do this decay happen? Or you are supposed to understand what is this decay all about. Well, let's take an example that the child has had milk in the night, and when the child has had milk in the night, and if you have not brushed the child's teeth, so what happens is usually the entire food gets coated over around the tooth. Bacteria act on it and it forms acid, and this acid is corroding the teeth. More often parents say that, by the time I realized my child's tooth, it was already brown or black in color. Well, the teeth don't become brown or black, or they don't get decayed overnight. It happens over a period of time. So say from, if you take on a scale of 0 to 10, initial signs of decay, which usually go unnoticed by you as parents, are the times when the teeth become, say for example, yellowish or chalky white patches, or certain discolored appearance or roughening of the tooth surface. Those are cavities, and that is the right time that you're supposed to visit the dentist, because that is the time when the tooth can be reversed by home care methods and simple in office measures. You don't have to go in for root canals and fillings and things like that. When the tooth crosses this stage and turns by a dentist, so you're not supposed to wait till that stage of life. Yeah. Most common parents usually say that, my child eats a lot of chocolates, a lot of sweets. If there are twins, then one child eats, but he has 0 cavities and the other does not eat, still he does not have cavities. Well, it is not about only eating chocolates. Let's take an experiment. A plain Cadbury that is locally available in the market, and you eat it. After 10 minutes, if you notice, it's totally melt down and there is nothing available in the oral cavity. But at the same time, when you say things like a cookie or a simple biscuit, a simple glucose biscuit, if you have eaten, so after 4 hours, if you open the child's mouth and see, it's usually going to be still stuck on the back molars. And it usually happens on surfaces which are the back molar on the inner sides of the teeth, the hills and valleys of the top surfaces of the tooth. So those are the areas which are more prone to decays. Yeah. Now, when we come on to how do we take care of them, the most easiest way to take care of them is by usage of a simple toothbrush and your toothpaste. Now the query comes, what kind of toothbrush I should be using for my child, or rather for yourself. Any parent should always take a soft bristle or an ultra soft bristle toothbrushes for the kids. Never use medium or hard, whether it's a child or an adult, because you're not washing utensils but the human tissues. So respect them. Use a small amount of pea-sized toothpaste to be applied on the bristles, and then you have to start brushing. What is important is you use any brand of soap that does not make you fair. Okay, so the same way, any brand of toothpaste is okay, provided the activity of brushing is done every day, morning at least 3 minutes. I repeat, morning brushing 3 minutes, evening brushing for 5 minutes. Yeah. Now the next is mouthwashes. Given the corona times, mouthwashes play an important and an excellent role in bringing down the viral load. You can use mouthwashes for rinsing the child's mouth once a week or maybe alternate days. Don't use it as a prolonged habit over a long time, but intermittently. A simple trick is, once you have come from outside with bathing, you have to take a small mouthwash and gargle for at least 1 minute. How does this help? Is this brings down the bacterial and the viral load. Yeah. Now, in office care, what you can do is periodically visit your pediatric dentist, nearest pediatric dentist every yearly, and your pediatric dentist is going to take good care by prevention measures. Times of this pandemic, COVID-19 times are difficult, and that is the reason you need to focus more on prevention rather than correction. So an annual visit and an annual checkup to your pediatric dentist will be very helpful. Your pediatric dentist can guide you by use of fluoride varnishes, which is to be painted on the surfaces of the teeth. All they do is paint the surfaces of the teeth with varnish, and this varnish makes a thin layer of protective layer on the outside of the tooth. So it's basically like a caries vaccine, wherein you vaccinate the tooth and you reinforce every now and then on an annual basis. The next trick that your pediatric dentist can help you is by use of Pitt and Fisher sealants. Now, what are these Pitt and Fisher sealants and valleys? So these valleys are the food retentive areas which accumulate the tooth and the dirt. So these valleys need to be sealed, and this is a very simple no drill process wherein your pediatric dentist can help you seal the surfaces, and so that the child is without any cavities lifelong. Yeah. So considering all this, so we have a number of questions which are coming up. Let's take each one of them. Mera Qureshi says, why does my baby mouth smell sometimes and sometimes not? Yeah. So kids usually have this tendency of pulling the milk inside the mouth when, and then they swallow. So every time that you feed your child, if there are no teeth present, it is important to clean the gum pads with a soft muslin cloth or a wet gauze. Just after every feed of milk, just wipe it off. Okay. This should help avoid the smell in the baby's mouth. Then, yeah, so Jenny has come up with a question that, can you suggest anything to control mouth breathing, as dentist told me so far for my son? Now, what is important is you need to identify the age of your child. If your child's age is less than 2, 2.5, or maybe 3, you can still give him some time. But controlled mouth breathing is very important, and Jenny, your pediatric dentist, has actually highlighted an important aspect. What happens when you start breathing through the mouth is when you start breathing through the mouth, a lot of allergens and pollens get inhaled, and the air is not filtered and warm, and then the entire setting of repeated episodes of cough and cold, indigestion, constipation, short attention span is a very important feature which goes undiagnosed many a times if the child is a mouth breather. More importantly, the child may have bloating and the quality of sleep gets disturbed. So what you're supposed to do is try to identify why the child is having these problems, because it is a multifold, whether it is anatomical in nature, obstructive because of adenoids or tonsils, or it is habitual. If it is habitual, your pediatric dentist can definitely help you. And there are simple clips available which your pediatric dentist will give it to you, and you make the child wear it every time the child goes to sleep, and it is corrected. Yeah. So we have a query from Jaya Udair, who says, why my baby milk teeth has not fallen. Now, parents, whenever you're shooting the questions, I request you to please mention your baby's age so that we can answer more precisely. Baby milk teeth has not fallen. Usually the teeth start falling down by 6 years of age with the front teeth. If it is not, many a times you can consider 1.5 year plus minus as buffer and nothing to worry about it. If the baby milk teeth has not started falling off even after 7.5, visit your nearest pediatric dentist. Yeah. So then we have again, what precautions should be taken? Margin after the filling are usually, depending on the type of filling, if it's a simple glass ionomer filling, then you need not feed the child for another 40 minutes, soft diet for the same day, and brushing 2 times a day compulsory. Okay. And then we have Lakshmi Mishra. She's asking what happens if you don't brush your baby's teeth. Well, the entire talk was about the same. What happens when you don't brush your baby's teeth is it starts getting accumulated. It results in foul smell. Then the bacteria act on the food, form acids, and this results in cavities. So it's always important, whether it's baby's tooth or a young adult's tooth, you should always brush the teeth. Okay. Lakshmi Mishra again has a question. How do you clean a baby's mouth with glycerine? Glycerine is just a lubricant. It can be, you just take glycerine over your fingertips, or if you're using those baby toothbrushes which are to be worn on your fingers, once you use them, you can just apply a small quantity and you can brush it. I would advise using a non-fluoridated toothpaste until your child is 2 years of age, and beyond 2 years of age, a small pea-size amount of fluoridated toothpaste. Yeah. So again, how do Lakshmi, you have another query. How do I clean my baby's tongue? The baby's tongue can be cleaned again with the finger brush which are readily available in the market. All you have to do is wear the finger brush and then clean it over the tongue surface. Nowadays we have beautiful tongue cleaners for babies as well available in the market. Then Navlaks Kapoor says, are you supposed to clean a baby's mouth? Yes, you are supposed to clean the baby's mouth. Okay. Prachi has a very beautiful question. She's asking that, can my 3-year-old start flossing? Of course, but it has to be done under parental supervision. You have beautiful tooth flosses available, the ones with the handles, which are with the Y-shaped handles. So they can go nicely in between the teeth. The only trick is first brush your teeth and then floss. Do not do the dirt more inside. So first brush your teeth and then floss your teeth. Yeah. I have one pair. Yes. So Nisha Jain is asking, can you suggest any toothpaste that the kids of 2 years can take because they intend to swallow it rather than using it as a paste? Most important point over here to note, Nisha, here is you're supposed to use a small pea-sized toothpaste, nothing beyond that. Kids below 2 years of age can use a non-label. Once your child is grown beyond 2 years of age, the same quantity. So before 2 years of age, you use a rice grain size, and about 2 years of age, you use a pea grain size of toothpaste. Okay. Mehrab has another question. My daughter is 10 years old and her teeth are becoming bit yellowish. Why is it so? Mehrab, you need to identify multiple factors. Your child is gonna grow into a teenage very soon. So what kind of yellowish tinge it is having, whether it is because of poor oral hygiene or onset of cavities, or more importantly, if your child is a mouth breather, then there could be some yellowish deposits which you need to really take care of. Um, Jenny has a query that also dental routine care I need to understand for my 4 years of child. And okay, so this another beautiful question. It's very important that when should I change my toothbrush? Ideally, every toothbrush has to be changed at around after every use of 3 months. But the most important trick that I would want to share with you today is change your toothbrush after every and any episode of infection or fever. Most importantly, if someone has had an episode of fever, the minute the person recovers, just change the toothbrush. In case there is no underlying condition, then your toothbrush needs to be changed every 3 months religiously. Yeah. Um, so any more queries from? Yes. Sanam Pavaskar has a query that my 13-year-old daughter, can I allow her to use big brushes? Okay, so dear parents, again, more importantly, understand that whether it's an adult patient or it's a kid, the mouth opening is limited and access to the behind molars, the behind teeth is very important. So whether you are 10 years of age, 13 years of age, and I repeat, you are 20 or even 50 years of age, your bristle head should be as small as possible. The reason is this head should go and fit in the back zones. So, Sanam, if your daughter is 13 years old, I would advise you can use the regular toothbrushes, but see to it that the bristle head is very small so that she gets access while cleaning her back molars. Yeah. Uh, yes. So Riddhi is asking that what if my child's tooth falls down during an accident? Very important. Now, it has fallen down is a milk tooth or a permanent tooth. If it was a milk tooth, you can just avoid it doing anything except for palliative care, that is control the bleeding and immediate relief. And you have to, of course, visit the nearest pediatric dentist who has to identify what problem it is. But if it's a permanent tooth, the take home message I would give you from this talk today is identify where the tooth is, pack it in, boiled cool water or milk if you are at home. And if the chemist is very nearby, order for normal saline and put it inside that and rush to your nearest dentist. The faster you intervene and which reach your dentist, the faster the dentist can take care of the problem. The same permanent tooth can be fixed and the tooth can be fixed for lifelong. Okay, so anytime the permanent tooth falls, do not just neglect, and time is very important. Never ever pack it in a newspaper or a tissue because you're going to kill the tooth and kill the fibers because of drying. If you do not have access to anything, and if the child is awake and the child can be communicated well, then keep the tooth below the child's tongue inside the mouth and awake and the child can be communicated well, then keep the tooth below the child's tongue inside the mouth and rush to your nearest dentist. Yeah. So yeah, so we have answered more or less most of the questions. Um, so with this, well, so to brief up, uh, more importantly, for kids, start using muslin cloth after every feed, clean the gum pads. Second tip is brushing twice a day compulsory, morning and evening, morning 3 minutes, night 5 minutes for kids. Below 2 years of age kids, you have to use a rice grain size of a non-fluoridated toothpaste, and about 2 years of age, you have to use a pea size amount of a fluoridated toothpaste. Change your toothbrush every 3 months and after every episode of fever. Visit your nearest dentist on annual basis, and given the corona times, trust me guys, this is the safest time to visit. It is very safe to visit your pediatric dentist because all the dental clinics are taking utmost care of avoiding any type of cross infection. Any more queries? I would just wait for a minute. And yeah, so there is another query from a parent about the usage of glycerine. Glycerine can be definitely used because with the so there is another query from a parent about the usage of glycerine. Glycerine can be definitely used because with the dry brushing, they can result in bruises inside the mouth. So you can definitely take a small quantity of glycerine. You can even combine your glycerine with your regular pediatric, kids toothpaste and use it as and when possible. Keep the child hydrated well, avoid junk foods, and most importantly, avoid giving child hydrated well, avoid junk foods, and most importantly, avoid giving any kind of sweet after 5 p.m. because the minute they start taking sweets in the evening hours, they have a sugar rush because of which they don't sleep well and they don't sleep early. So by 11 or 12 in the mid of the night, you start realizing that they start getting more active. So that's because of the sugar rush. So try avoiding sugars in the evening hours. Always substitute your sugar with jaggery or any other natural substitutes. Yeah. So with this, I, Dr. Vivek Jogani, pediatric dentist, Mumbai, in association with BabyChakra, thank you for this beautiful time and session. Hope you have a wonderful time and stay safe, stay healthy. Take care.